a lot of people are starting to ask the question. They're getting that paradigm shift. So now we got to take the next level. When you ask that question, you got the answer that's coming out. You got to be looking at the nonverbals, and you have to be looking for this courage and this resiliency and the creativity, because the story itself is overwhelming. But really, the question should be, what happened to you, and why are you still sitting here willing to talk to me? Why haven't you given up? I would never ask that to a child, but you know what I mean? We still miss it. I mean, these kids, we're talking about the kid population, they had no one protecting them. They had no resources, and they're still trying to grow. Now, what is that in that little human being? What is that? And how do we make sure we don't diminish that as we approach them and do our treatment planning? So trauma-informed care is so new because it does work, and because everyone's getting this shift in the paradigm. Don't ask what's wrong, ask what happened. And so I'm saying, as an early adopter, okay, great, we got that piece. We know how to get kids safe. We know how to say, it's not your fault. Something happened to you, right? Now, why do you want to work on this? What are you bringing to the table? You're an amazing survivor. So what's in this for you? What do you want next? And instead of telling them what they need, see what they say. And help them understand what's reachable today and they're going to have to work on. It's hard work. Recovery is hard work, and you don't make it easier by doing the hard work for the client. And yet they need tons of love. They need to be held. But what we're doing is we're weakening survivors' abilities to recover if we try to take away their trauma, if we try to take away their suffering and their pain. And that's where I think we're teetering now. And I think it's part of a normal, appropriate evolution around changing a whole system of care and a whole approach to a disease. Some people call it a disorder. What combatants, or I think kids, would call an injury. It's an injury. There's a huge mind shift towards trying to do this in a way that actually works. So that's fabulous. And I'm just pushy and too intense about it many times, but I work daily with patients and with providers. So what I'm throwing out here is, as you adopt the paradigm shift and you're using the prompt questions like, hey, it's not what's wrong with you, it's what happened to you, that's the beginning, but that's nowhere near where we need to be. So now we have to recognize this currency I'm talking about, because why would the survivor even talk to you? Why would they want to get better? What's going on? And whatever that is, and it's hard to name, but we can give it the broad name of resiliency, coupled with hope, coupled with courage, coupled with extraordinary innovativeness in surviving, right? Kids do amazing things to survive, and young adults. And some of it's called sick and risky behavior, but it's pretty ingenious survival techniques. How do we not diminish that currency in their little bodies and in their minds? And how do we not make them have an institutional mind by doing too much for them?